And oftentimes the pain, it occurs before you're bone on bone and you need to have a surgery for it. So I want to show you some exercises. For each of these stretches that I show you, you want to do about 2 to 3 minutes every day. And I would suggest you do them every day for 2 weeks. Hello, my name is Jeff Petersen. I'm a physical therapist. I've been a physical therapist for 35 years. I've estimated almost 90,000 treatments, over 20,000 individuals, and I want to share a little bit about what I've learned. Specifically today, we're going to talk about exercises to help if you suspect you might have some hip arthritis or if you've been diagnosed with hip arthritis. About 26% of the women in this country and 18% of the men have been diagnosed with osteoarthritis. That's the type of arthritis that's from wear and tear. And oftentimes the pain, it occurs before you're bone on bone and you need to have a surgery for it. So I want to show you some exercises. For each of these stretches that I show you, you want to do about 2 to 3 minutes every day. And I would suggest you do them every day for 2 weeks. And if you see no change or your hip gets worse, by all means, you can give us a call. We'll display our number later, or leave a comment on our Facebook page. Also, you can go see your physician and he can do an x-ray and sometimes he'll do an injection in your hip to see if that's where the problem starts. So we're going to bring Anna in. Anna is our model. She's an athletic young lady who plays volleyball repeatedly, right? You're an excellent volleyball player and a line dancer extraordinaire. Is that true?
That is true.
That is true. So let's have you lie down for the first exercise. Now the piriformis is a muscle in the back of the hip. There are conditions related specifically to the piriformis, but it is a muscle, if you have hip pain, that will go into some guarding. And guarding is a protective mechanism. So we want to try stretching. And in this case, we're going to work on Anna's left hip. So Anna, we're going to have you cross your left ankle over your right knee. And then you're going to gently pull that right thigh up towards your chest. And I said right, but you're right, left. So we're going to, you did the right thing. So we're going to pull this left knee towards her right shoulder, and she's going to feel a gentle pulling right in her buttocks. You feel that pull gently? Now you see Anna has excellent mobility, and the way we're looking at her mobility is the line of her shirt and the position of her hip. You want to gently pull that knee until you feel tension in the back of the hip. If you feel some pain in the front of the hip, then you want to back off a little bit. That's really important. She's going to hold this for a minute, 2 minutes, and as long as 3 minutes. So you want a total stretch time of 3 minutes. You can do 3 repetitions for 1 minute each, or a total of 3 minutes. I would encourage you to do this with a timer. So the next one we're going to do is a hamstring stretch, and there's a couple different ways to do that. One way is by using a stretch belt. So in this case, we're going to put the stretch belt around the ball of her foot. She's going to grab the belt, and she's going to gently stretch. In this case, she's also getting some stretching of her calf, but she's working mainly on the hamstrings, which attach to the back of the knee and to the bone that you sit on. You feel a gentle stretch there? Okay, and again, you're going to hold this. Try to get a total of 3 minutes stretching. If you want to make the stretch even more serious, she can try laying this leg down and stretch that right hip at the same time, and you'll get more of a stretch. Okay, the next stretch we're going to do is a hip flexor stretch, because the front of the hips get tight as well. So in this case, you're going to pull your right knee up to your chest. Yep, scoot to the edge of the table for me, please. Right knee up to your chest, and she's going to hang that foot off the edge of the bed, just like that. And you can see she's getting a gentle stretch right in the front of her hip. And again, you should feel a gentle stretch, no serious pain. If you feel pain on the back of the hip when you do this, that could indicate some compression in the back of the hip. You want to hold off, and that would be a time to certainly give us a call. So then the next one we want to do is what we call the opposite arm leg stretch. This is a good overall stretch for people's back and their hips. So what she's going to do is she's going to keep her right knee bent up and her left leg out straight. And then she's going to take her right arm and she's going to reach up above her head. And I want you to imagine she's taking her left heel, driving it that way as far as she can. She's taking her right fingers and driving it this way. She's getting elongation of her spine, her rib cage, and her hip. And this is an excellent stretch. It's an excellent overall stretch. She's going to hold this one for 10 seconds. Then she's going to switch sides and hold the other one for 10 seconds. Or again, you could do 30 seconds for however many repetitions. The idea is you want to get about a 2 to 3 minute stretch on each side, however you break it up. And then the last one is a little bit of a stretch and a strengthening exercise. So let's have you bend your feet up. Let's spread your feet just a little bit. Now, we want to make sure that when she does this exercise that she's really working the hip and not the back. So in order to do that, we're going to have her do a pelvic tilt. That's when you flatten your back into the table. She did an excellent pelvic tilt. And then she's going to lift her hips straight up towards the ceiling. Just like that. As she does that, she's going to squeeze her buttocks, and she should feel it in her buttocks and in her hamstrings. Is that where you feel it? She's going to hold it 1, 1,000, 2, 1,000, 3, and she's going to come down. And she's going to do, depending upon your strength, you can start off with 2 or 3 sets of 10, but you want to be able to do 3 sets of 25 ultimately. It will take some of you a long time to get there. So in 2 weeks, if you can do 3 sets of 10 of these bridges and feel it in the buttocks and hamstrings and not your back, then you're doing it well and you're strengthening your hip and you're stretching the front of your hip, and that's a good exercise. If you have any questions, again, feel free to call us or to see your physician. And I hope this was helpful. If it was, please leave a comment on our Facebook page. Feel free to give me a call and subscribe to our YouTube channel.